Scott County, providing safe, healthy, and livable communities.
We're going to receive information on Scott County Delivers topic, work to end child abuse and neglect. Together we can. And we're looking in a room. We've got a few folks in person, and in Zoom land we've got quite a few more. So looks like Chris is wanting to kick this off. So good morning to everyone in the room, and good morning out to everyone in Zoom land.
Good morning, Mr. Chairman, Commissioners. This morning, Brad Davis and I have the privilege of leading a conversation with a large group of folks that have been working together on the Together We Can initiative. And as you know, this is an initiative that you really started. It was part of our last strategic plan, and there was a lot of planning and sort of raw beginnings at that time. And then when we reviewed and updated the strategic plan, it took more shape, and you continue to support the work of this initiative. It is really one of our strongest examples of innovative practice. Like, is there a way we can take our existing programs and work differently? And you're going to hear a lot about working differently today. It's the first time that we're here to do a formal update to you on the progress on this strategy. It is too early for us to connect dots that says this work leads to this change in data. But what we are going to talk to you about are what are the markers that we're looking at in the community that tell us something about if this work is effective over time. And so we're going to talk about high school graduation rates and third grade reading levels and screenings and connected kids and all those things that you pay a lot of attention to as we come forward with Scott County Delivers presentations. There's kind of four themes you're going to hear. You're going to hear a shift from reaction to prevention. You're going to hear a shift from how we engage with the community, that this is a different level of community engagement. You're going to hear an expansion of nonprofit partnerships and offering families choice and offering them alternatives to service beyond government programs. And you're going to hear about partnerships leading to change. And I have really pushed this group, as we have talked about, collaboration is so important, and this is a very relationship-based community, and we value that. And we also want to see results. And so let's talk about what are the changes that we're making as a result of these partnerships today. So I'm going to start with some introductions. Brad and I are going to lead the questions. We'll leave about 10 minutes at the end for questions from the commissioners, but we also just invite you to jump in. This is a topic that we know you're really knowledgeable about, so jump in as you wish. And I'd like to start with, we have a good mix of folks. We have 3 presenters in the room. We have 5 remote, kind of a nice mix of county staff and private partners. I'm going to ask to start with Suzanne Arnson because she also has some acknowledgments to make.
So good morning, Commissioners. Thanks for having us today. I'm Suzanne Arnson, the Child Welfare Manager. Before we sort of move on with introductions, I do want to do a special call out. On the Zoom line, we have 2 pretty critical partners that I want to acknowledge who have not only supported us through funding, but also through partnerships. And so we have Mike Scholl from Casey Family Programs. And Casey Family Programs and Mike have been active in really supporting our efforts to move interventions upstream and focus on prevention. So want to just acknowledge that Mike is on the line and appreciate Casey's support. And then the other person is Colleen O'Keefe. And Colleen is from the Sauer Family Foundation out of St. Paul. And the Sauer family has been generous to support some pilot work within child protection through funding, as well as really, again, partnership to talk about how do we sort of vision and potentially transform child welfare to a more prevention base. So I just wanted to do those 2 call out to some important partners.
I'm Vicki Holbert, the Child Protection Workers in Scott County.
I'm Mary Kay Stevens, Public Health Supervisor, Scott County Public Health.
Let's see. Heather, would you introduce yourself, please?
Hi, Heather Lopez,
Heather, I'm going to ask if you would turn your volume up for us when you get a chance. Tamara, would you introduce yourself?
Hi, I'm Tamara Stevenson with St. Francis Regional Medical Center. I'm the manager for mission and community benefit engagement.
Thank you. Lisa Welter?
Good morning, my name is Lisa Welter. I'm the Safe Families for Children National Leadership Development Director.
Thanks for joining us today. Melissa?
Hello, Melissa Gardner with the CAP Agency, formerly Crisis Nursery Manager, currently the Associate Director of Prevention Services.
Thank you. And Jake Grusing?
Good morning, everybody. Jake Grusing, Scott County Library.
Thanks for being here, Jake. All right. Brad, I think you and I are going to share this microphone this morning. So maybe we'll just start off. And I would like to, it works best, I think, in this remote environment, if we can kind of go through the packet a little bit sequentially. So we're going to start with some questions on that upfront narrative. And so I wanted to first throw out a question about on page 3, there's a list of protective factors. And I'm wondering if you could talk about there are other protective factors listed in the data later. And so I'm just wondering if you can talk about the research around these protective factors because they come up throughout the material.
I think we'll have Heather maybe dive into that question.
Okay.
Sure. So, can you hear me okay? Sorry, I lost my voice yesterday and it's just coming back. Can you hear me?
Yes.
Okay. So the family protective factors is framework that comes from the Center for the Study of Social Policy, and it's framework that has proven to reduce child abuse and neglect. So as you build these concrete supports, which are meeting the basic needs of families, so housing, food, child care needs, and the knowledge of parenting and child development. So we know that child well-being is directly related to parental well-being. So how do we support parents really understanding ages and stages that their children will go through for healthy development? And then how do we build resiliency in parents? So when they struggle, when times get hard, if there's a global pandemic, how do parents have that resiliency and that support and time for themselves and self-care to manage themselves and their children? And then looking at social and emotional connections of children, is how are we helping support children in growing up attached to adults? How are we supporting their attachment and their emotional connections to not only their parents, but other protective adults and family members in their lives? And then those social connections, how are we building a network around families? So many of us, I think in Scott County, are lucky enough to have family supports nearby. But some of our communities don't, right? So how do we really provide those social connections and interactions through our districts, through our faith communities, to wrap around families and support them? So these 5 family protective factors are really evidence-based in preventing child maltreatment.
Thank you. Can we look at page 4, please? And on page 4, there's a list of expanded continuum for prevention services. And I wonder if someone could talk a little bit about what are the new features that have been developed as part of the work of this initiative. So some of those are organizations that have been in Scott County for some time, some are new. But what are the new elements that you would attribute to the work of Together We Can?
I can maybe start us off and then would certainly invite other panelists to join me. Since we've really talked and launched Together We Can, we have been able to formalize a partnership with Treehouse around supporting youth having access to youth support groups, as well as individual mentoring in 2 of our communities, New Prague and Savage Prior Lake. And Treehouse, just this summer, we launched a partnership for them to focus on providing increased supports and mentoring for children who are likely to age out of the foster care system. And so again, that's a new partnership. Safe Families for Children, we are just actually launching a new partnership now. We really see that as an upfront prevention-based partnership where families can access mentoring, supports, and we're even certainly doing some exploration of support around virtual learning for families, given the current environment. So that's a new partnership that we, again, have just launched. Some additional work that we've done with the Catalasso group around circles. And that really is a restorative justice practice where we are talking about how do we help families and systems engage in conflict resolution in new, more innovative, and really peaceful ways. And so we are looking to bring training here. We had intended pre-pandemic to do an in-person training this summer. We have postponed that to early 21 to reevaluate based on sort of where we're at with the pandemic. We've also launched a formal partnership with St. David's for Children to do some evidence-based parenting skills for families involved in child protection. We are also working and have redefined a relationship and contract with NAMI. Historically, they have provided some community-based support groups, although given the pandemic, we really needed to sort of shift because of the not meeting in person. And so we have NAMI who's really doing outreach services to families with children who may have emotional behavioral challenges. And then as part of the Together We Can, those subcommittees are actively engaging with different providers around peer recovery services and what it would take to bring peer recovery to Scott County. So are there other folks? Mary Kay, maybe I'll pass it to you to see if there's additional comments.
Sure, I think I can comment about some of the collaborative work that happened between our internal systems to some degree with child protection and public health. We've
Okay, can you use the microphone, please?
Yep.
Thank you.
We've adopted some additional protocols and practices so that we're working more collaboratively and upstream with families. For example, if child protection reports come in that are screened out, we have an opportunity to offer some supportive services. If if a report comes in about a parent with substance use during pregnancy, we have both a nurse and a social worker reaching out to them to offer some connections and support to move forward in a positive way and some of those things.
Suzanne, could you, I noticed you had the Beacon one listed there. Can you, and they just spoke to us, some supporters. Where is that in, and what are the discussions revolving around that right now?
So thanks for that question, because it's sort of like hot off the press. So Beacon, there is a current grant that has been, or RFP that has been released through Corporation of Supportive Housing. And it's specifically a housing program for families in the child welfare system. And so last Friday, Beacon and Volunteers of America and Scott County had a very preliminary conversation on, is that an opportunity that Beacon is interested in considering as part of their planning around Prairie Point. And so I think it really is, we have invited Beacon into the Together We Can work, both to look at, again, what can that Prairie Point site offer in terms of additional supportive services aimed at prevention, and how do we integrate and begin to plan collectively for that over the next 12 to 24 months.
Thank you.
All right, Nikki, can you tell us a little bit, well, let me ask one other question first, sorry. Could somebody talk, maybe somebody from one of the private agencies, so there's a lot of people, there's a lot of work, there's a lot of these new launched partnerships. How do you mobilize this to get things done? Like, how do you mobilize this to meet needs?
This is Tamara. I would say one of the things that has been different with Together We Can is actually having a staff person, like having some infrastructure there, like that's how. Like there's so many collaboratives around, and I feel like one of the things that has been different here that has helped us move so quickly from ideas and models into saying all different people at the table, you know, we're really level setting, having new people at the table, having people who aren't normally there together, that has made a big difference. But having someone whose role it is to kind of move the work and, and keep us moving forward, I think has been a big help too.
Nice, thanks. Do you have examples of things your group has accomplished together because you had all those different voices at the table? Does somebody want to talk about the United Way grant?
Yeah.
Absolutely. Melissa with the CAP agency here. I can talk a little bit about our United Way collaboration. And so back in April, a grant came out through United Way that was offering direct supports for families in the community. More specifically, families that may not be eligible for a lot of the stimulus funding or enhanced unemployment, things like that. And we pulled together a team with Together We Can and pulled in some other partners, including Southern Valley Alliance, that works with domestic violence victims, as well as a new partner at CAP, Esperanza, that's been doing just amazing work with their food distribution in the community. And we applied for this grant as a collaborative, and were awarded $40,000. And so that is $40,000 in direct service funding that is going, and it went out faster than I could even keep up with it. The funding helped 46 families directly with cash assistance, which was part of United Way's rules around how we wanted to get this money out to the community. We have helped 46 families with cash, 11 families with rent assistance, as well as Southern Valley Alliance, where it was able to help 12 families that were suffering from domestic violence issues, which we've seen a big spike in since COVID. And in addition, a big chunk of that support went to fund some of that food distribution that we see in the community in partnership with Esperanza. And so, I think, the biggest thing I can say is that if we had applied just as a CAP agency, there was a cap of $20,000. But as a collaborative, bringing in community partners and sharing in getting the resources out there, we were eligible for much more and twice that amount. And so, we definitely prioritize families involved with child welfare. And so, families or child welfare workers at Scott County could reach out directly to us with the referral process that kept clients' information confidential. And we were really able to get that money in the hands of the families that needed them in the moment. And it definitely made a huge impact. Last week I was out at a food distribution at Esperanza, and I connected with one of the volunteers there, and she was able to just tell me several stories. One of a family who had a car payment due, and they were so panicked that if they didn't make this car payment, it was going to get repossessed, and the domino effect, right? They were going to lose their job, which meant they were going to lose their housing, and when they were provided this cash, it went right to that car payment, and the family was just in tears and so appreciative. As well as another family with a rental assistance situation where they truly felt like they were going to be homeless, and without that support, it wouldn't have been possible. And so that United Way grant funding went fast. We've got a little bit of money left over for additional supports and supporting some of our overnight stays for families, but it really was a great partnership and would not have been possible without the work of Together We Can.
Thanks, Melissa. Nikki, can you talk about how is this different for the families that you work with every day, or how is it different for you as a worker in this environment?
I think it's been different as a worker to finally to see that like the community coming together to help people and taking responsibility for kids that may be abused or neglected. It hasn't been solely the responsibility of child protection, and I think that's changed even from the first meeting. That absolutely the communities, kind of schools, hospitals, clinics, everybody has kind of come together to figure out what they can do to help prevent child abuse and neglect. And I think for the families that feels different. Because it's not such a punitive system, when you feel like you have the whole community standing behind you wanting to help versus you've done something wrong and now you've been assigned a child protection worker.
Right. Thanks. I wanted to ask just a couple of questions about COVID. The documents reference a lot of things that are put on pause because of COVID, but I'm wondering if there are things, are there any improvements, are there efficiencies or adaptations that have come out of COVID that you might hold on to as a child protection worker?
Yeah, I think certainly it's helped connect with people in a different way. I think it's also helped us look at connecting parents to their children in a different way, especially children in foster care. By using, Skype or Zoom meetings, all of those things, I think help clients feel a little closer to their kids. At times there wouldn't just be a visit, but it could be like putting kids to bed over Zoom or eating lunch together. I think that that's also helped us connect with clients. I still have done most of my visits in person, but I'll find like clients mostly now when I call them, they want to Zoom instead of just talking on the phone. Like, I think it just makes people feel a little more connected that way.
So are those some things that you'll continue?
I think a lot of those things we will continue, yes.
Brad, do you have narrative questions? I'll step aside for a few minutes.
I think what impressed me the most when I read the packet is the rich amount of data that has been collected. And so I just have a few questions on some of the data and the snapshots. What impressed me is how there's data across decades for a lot of these measures. And I think that's important when you're dealing with this topic and see how interventions might be changing the trajectory of some of this data. And so there was a couple of snapshots that caught my eye. It looks like there's a swing one way or another, and I'm just wondering if we could talk through some of those. One is on page 18. This was one that caught my eye. You have data across 7-8 years here, the rate of children who are subject of maltreatment. And I'm just wondering, when I see the increase in 2018 and in 2019, if we're looking at truly changes in rates, or are we looking at changes in definitions or reporting, or what that could be?
So thanks, Brad. Good question. Certainly we saw, so there was some pretty substantial child welfare, child protection changes that came back in 2015, 2016. And what we saw from that, if folks remember Governor Dayton's task force on the protection of children, it was in response to certainly a couple of very tragic child fatalities. And so in response to that, there were 93 recommendations that really changed the landscape in many ways of child protection in bringing more families into the child protection system. There was concern, certainly by some, around screening criteria and how many cases may have gotten screened out. So we saw a broadening of criteria, and so in some ways I think you're seeing changes in the system that have resulted in more families coming in. From a practice, I don't know that we have changed practice other than to respond to changes in law.
On page 23, that was another data set that caught my eye in terms of seeing the sharp decrease in the percent of children enrolled in child and teen checkup. When you look at the trend lines from going all the way back to the first part of the decade, just wondering if there's any reason why you see the drop in the last couple of years on that data point.
I can take that. So I think there's some things that point to that perhaps with the way that healthcare has evolved, that there would be more kids who would be eligible and covered. This is a program that's for kids on medical assistance or Minnesota Care. However, I think one thing that may factor in is sort of a climate of how people feel about accessing services and things, and some barriers and challenges that may be created there.
Can you speak more to that? What are...
Well, of the population that's eligible for child and teen checkups, there are some that may have less ability to access or feel less comfortable to access governmental supports around healthcare. It can be many things such as transportation or moving around a lot and things like that that are more the barriers around actually getting in for those well checks. But I suspect that the drop is, and I should say the disclaimer is that I don't work directly in this program, so happy to get further data for you about that. But that as families are less comfortable accessing supports just because of political environment or barriers that are in the community, that gets in the way of them accessing these programs that help make sure kids are on track and getting in for their care.
Can I ask, do you think, because a couple of years ago, it seems like people started worrying about all these vaccines and stuff, like they were carrying some sort of chips and stuff, that people didn't want to go get them anymore. Is that about when that happened, or is that, am I thinking wrong?
I think that you're talking about people who are cautious about
Adverse
vaccination.
Vaccines.
Exactly.
Some populations, because I remember like a couple, it's been on the internet or on the Facebook or whatever, so.
It could be impacted by a growing
Some fears.
concern about that.
Yeah.
However, there are many options in healthcare around providers who have different perspectives or work with families around those things. And so I would suspect that if vaccination being just one piece of that well child care, that families would still continue to take their kids in for checkups and things. But it could also be a factor.
All right, I have one other data-related question before I'll turn it back over to Chris. And it's a question for the entire panel, but I'll use slide number on page 30 to frame up the question. What I liked about the graph on page 30 is it looks like we're looking at a couple of variables that impact proficiency in reading and math in third grade. And so it's just an interesting set of data to kind of think about. But my broader question is, it looks like we might be seeing a result of some data sharing that's happening between a couple of data sets, perhaps, of reading proficiency and those that are involved in child protection. And I'm just wondering for the entire panel, how is data sharing going between agencies, between efforts? Is there still some obstacles in place where you wished you were able to get more data or better data from other agencies in order for you to show the progress of your work?
Thanks, Brad. I'll maybe give us a starting point and then others can chime in. In terms of the data sharing question overall, Brad, I think there continue to be challenges. This data on page 30 is the result of some data sharing between the Minnesota Department of Education and the Department of Human Services. So there's agreements across those state agencies that allow aggregate. And so this is information, again, from state agencies regarding, again, the intersection of kids in our child protection system and then education achievement. In terms of local data sharing, I think it continues to be a challenge. As Scott County and Together We Can and CAP work in partnership, certainly I think some next evolution in those conversations are how can we take a look at perhaps information sharing to begin to examine parents helping parents, and is that support group helping keep families out of child protection? But that gets into then obviously confidentiality in the exchange. And so I think there are opportunities for visioning out what would need to be in place around data sharing, but continues to be a challenge. Any other panelists have input?
I would just add that I believe public health is pretty close to a data sharing agreement with Shakopee School District to better support young children and families as they move through the education system.
So let's keep talking about education for a minute. I'm wondering how this team's work aligns with Live, Learn, Earn.
So I can speak to one piece of that. In public health, we've been in prevention work For a long time, that's really our thing. It's been amazing to see how so many community partners have come together around this. The whole community really mobilized. There are new faces at all of these kinds of meetings, such as Live, Learn, Earn, who'd been taking a focus of a sub-slice of that, for example, in the educational preparedness group. And so some of that work has started, but then it's really launched into other community people owning it and participating in it. For example, it brings together some of the work we're doing in the B25 group that has started. We've got new faces and players there. And also some of the community health improvement collaborative work that happens through public health too. But it's just been expounded based on the Together We Can work. And I think one key piece of that, as has been mentioned already, is having someone who is dedicated staff time to really foster those relationships in the community and keep that moving forward, and then bringing us all together in our work.
Are there initiatives within your group or strategies to promote things that we think are good for kids, like immunizations or preschool screenings, or like are there active efforts within this group to support some of those data elements that we look at? Ooh, sorry about that.
I think there's, I can have maybe Heather join in a second around some of her work to across Live, Learn, Earn as a way to, I think, create bridges and integration rather than duplication of efforts. I will say, just as a sort of a concrete example, the board will have an opportunity to hear later this morning about a grant proposal we're interested in applying in. And part of that discussion is the interest of how do we make preschool screening more accessible to families really across the community. And so one of the potential strategies is, as part of the grant application, is to bring in preschool screening to these community hubs. So just kind of a concrete example of how we're taking different pieces from different initiatives or groups and try to build those together.
I also had a question about, there's information in the narrative about kind of this two-generation approach, and we believe kids are going to do better if their parents are doing better. And so when we look at education and literacy, are there supports for parents? Like many of these parents probably have educational gaps of their own, right? So are there supports for them as we support kids in the literacy development or literacy-rich environments?
Heather, do you want to jump in on that?
I was actually going to invite Melissa and or Lisa to talk about our partnerships with them and how they're supporting parents.
Absolutely. I can talk a little bit about Parents Helping Parents and the work that we're doing through Together We Can. And so, more specifically, really supporting the families that we serve and supporting their unique needs has been a priority for us. And so through Together We Can and the partnership that we've created, our plan is to start a group in Jordan in person in the spring, but in the fall we're launching more of a virtual option for families, which will include a Spanish-speaking option, which I think is definitely needed in the community. And through our partnership with Esperanza, I think will be very fruitful, given that we've got those referral partners that can really bring in that audience and help us with that outreach. And so, I think one of the things that we see with a lot of the families in Parents Helping Parents is kind of a benefit or a bonus to the program that we have, is that families who are learning English are practicing their English. And so we've had several families that say, this is the one place I get to come each week where I can practice my English, and they really appreciate that and having that support. And in addition, we bring interpreters in where it's needed, but also know that there's a need for additional language options for families. And so we're really excited about that new opportunity out in Jordan to create that Spanish-speaking group.
Nice, thanks.
I can follow that, Melissa. Thank you. Lisa Welter from State Families for Children. One of the hallmarks of State Families is providing wraparound support to parents and their kids. So this two-generational approach it works very well. We primarily recruit through the faith communities so that parents are mentoring parents, and through that we do family coaching. And so we really are able to customize our approach
and meet the needs of the parents and also the children. But we do that through that community lens, primarily through the faith community.
Thank you. Jake, did you have anything?
I would add more broadly, since COVID, I think Together We Can has really shifted in our outreach. So we have a list of over 320 families across Scott County that we're reaching with supports around those 5 family protective factors. And so it will be supports for parents about here's what you need to do to support your 3-year-old tantrums when they can't see grandma. Or here's some Scott County resources where you can access food. And so I think by getting that information into the hands of people, it's also been super helpful in a time where what we need more than anything is those relational connections, and we can't have those in person. And so how do we support resources for families to access those virtually?
Jake, did you have anything to add around the parent, like supports for parents on the literacy piece and the literacy-rich environments and creating that for your children?
Yeah, I do. Thank you, Chris. It's obviously hugely important, right, for everybody, for all kids, to make sure their parents, their caregivers are engaged in that child's healthy development. And I don't think anybody would be surprised, like when there are ACEs present in the household and kids are getting, placed out of their homes, nobody would be surprised that it's hard for them to focus on school or their 3rd grade reading, any of that stuff. I would like, if I can, just to say one other thing about Live, Learn, Earn, and its relationship to the Together We Can work. Yeah, Live, Learn, Earn broadly looks at transportation, housing, workforce development, which includes some post-secondary education, and the educational preparedness. And I think that without ever being probably as explicit as we could be about it, we always return at Live, Learn, Earn to the reality we're trying to respond to, which is the issues in people's lives don't fall into neat buckets that align perfectly with existing programs. So I think there's a belief there, and it certainly shows up in everything Together We Can has been doing, that our solutions need to be as integrated and as accessible as possible. And you can measure success by how fast and how far we move some of these needles in community indicators and the data that we have in the packet, but you can also measure it by the collective willingness to keep taking that next step together. And Together We Can, Live, Learn, Earn, I think both have done a pretty good job continuing to bring people to the table. And it doesn't always show up in the box score. I've always thought of Live, Learn, Earn. I'm a basketball guy, like the pass that leads to the pass, that leads to the basket. You don't get an assist for that if you make that first pass. It doesn't show up anywhere, but it was the right thing to do, and it led to the right play. And I think Live, Learn, Earn does that, and stabilizing some of those big systems that have a huge impact in people's abilities to care for their children. So it doesn't always come through, it's not always clear, but I do believe it's there in Live, Learn, Earn's work, and I think part of that idea is there for how Together We Can operates as well.
Thank you very much.
Jake, this might be even a little premature, but you and I quite often talk about discussions, right? And the importance of just talking and how that leads to connections. We have a potential connection coming up from a private donation. Do you just want to hit on that a little bit and potentially what it could do for 3-year-olds? It's not finalized and it's going to take a partnership, but just a little background, what we're trying to work through.
Yeah, so again, just the importance of talking about some of these issues over and over and over again. Sometimes whether people want to hear about them or not, they start to land in a different way for people. So we have a couple people in our community who have stepped up in a really, really big way. We're going to bring it to the board in a couple weeks to make a significant donation to pilot a project in partnership with Amazon to get some Kindle Fire Kids devices that will be pretty locked down to just reading educational applications. And we're working on partnering with one of our local school districts to get those out at the early childhood screening, that maybe those could be an incentive to bring your child in to get screened at free. If you do that, you'll get a free tablet with full access to Amazon's early literacy resources. So I think it's one more small thing, and that's one of the best parts. You know, we've talked about this before here, that there is no silver bullet. It is that silver buckshot. That's one little thing. People in the community stepping up, making a donation, saying we'd like to find a way to try something like this and see if it helps. It won't be the solution, but it's intended to be part of the solution. So I'm excited to see more of those details come together and to bring more of that information forward to this group. But to Leslie's point, it's all about continuing to talk about these things and always making additional room at your table.
Can I just jump in on a second to piggyback on, I think, what Jake was talking about? I think in some ways that it's again difficult to figure out where it fits in the data, but there's a different movement around this idea of breaking down silos and moving away from sort of turf. I think in years past, if we look at how do we bring in services, right, because funding can be limited, there's this protectiveness of, but this is sort of mine. This is a whole different, as we bring in partners, it is really looking at how do we bring in partners that complement each other, that we're not in competition with each other, but what are the needs and gaps within our community to better serve kids and families, and then how do we create the pathway for anybody who wants to come to the table to serve.
Thanks. Can we talk about, both Jake and I think Mary Kay referenced the ACEs data that's on page 32. Can we just look at that for a second? So I wonder, Mary Kay, if you could just give us just a quick, just super quick refresher on ACEs and what that means and why it matters to looking at kids' health and education and development.
Sure. ACEs, adverse childhood experience, are those things that we know from research, if kids have experienced them, have increased their risk for health problems and the kind of challenges that may get in their way in long-term success, particularly if they have toxic levels of stress or trauma, those kind of things. We know there's some physiological impact of that and school impact, school success impact, those kind of things. So what this chart is showing us is on the left side, you can see, this comes from Minnesota Student Survey data. So on the left side, you can see that kids have designated these types of things that they have experienced and to what degree. And so you have a comparison of what that looked like for 8th, 9th, and 11th graders in 2016 and what that looked like for 8th, 9th, and 11th graders in 2019. So you can see the higher the rates of ACEs, the more, I think that's actually in one of our later charts, where it talks about how the accumulation of those risk factors really increase the factors against that. So the thing we do in buffering that, which is throughout here too, and we've been talking about today, is not just prevention of adverse childhood experiences, but also promoting protective factors. Again, our list of protective factors at the beginning, connections with caring adults, decreasing these types of experiences, but also building skills and connections in people so that they're able to weather challenges of life and buffer some of those negative health and functioning factors down the road.
So then building on the data that Brad was looking at earlier on page 30, so is that surprising that kids in child protection, who you would presume have some additional exposure to ACEs, that they're performing less well than their counterparts?
No, not at all. In fact, third grade's often looked at as a measure of how that foundation has been laid. There's some studies, if you look at it from sort of the opposite side, not just about projecting what they'll look like in the future, but we can look at some studies about kids' experiences and what they look like at third grade related to their early foundational years. and their level of ACEs, so.
There's some new research, I think, coming out, and it's sort of a newer conversation. So we hear a lot about ACEs, but we can also talk about sort of the reverse end of that continuum. Protective factors are really this idea of positive childhood experiences, or PCEs, because we like acronyms. But Dr. Bruce Perry, sort of internationally known child psychiatrist, has done a lot of studying on trauma and how do we, again, mitigate the trauma that kids experience, and that really is how are we looking to create increases in protective factors, how do we wrap networks of support, healthy caring adults around kids and families to help, again, weather or mitigate the perhaps abuse, neglect, trauma that kids have experienced.
So I wonder if we could take, if everybody, and I'm going to ask you to be succinct, but to speak to one piece that we haven't talked about yet that you think has been really strong in the work of Together We Can, and one piece that you'll be working on going forward.
I think for me, the one piece that I think has been very strong is the community involvement. I think moving forward, like COVID has certainly impacted some things, but two of the big things that I think we've tried to engage is schools. And obviously at this point, schools just can't take on what we're doing with COVID. And I think in addition to that, we've also tried the circles training. And I think our idea had been to engage like the retirement community in supporting families. And I think that's another thing moving forward that would be beneficial. And Together We Can.
Nice. Thanks, Nikki.
In terms of what has gone well, I think this is really the first time I've been with Scott County and going on 23 years that child welfare has intentionally engaged in prevention work and prevention coupled with community engagement. So I think that is both exciting and something that has gone well over the last 18 months. From where do we want to go? From more of a practice standpoint, there is active work being done across metro counties and the state to look at perhaps how do we divert families from entering the child protection system. And so I would hope if we were to be back here in a year that we'd have some updates around the potential for legislative change around that. And as I mentioned earlier, I think continued conversations around integration of data.
I think I've been most excited about the relationships we're building. When you think about what we do one-on-one with families in some of our programs, and you think about what we want for parents, and you think about what we want in our communities and people's connection to the community, it all comes down to relationships. And I think there's been so much work in developing the kinds of relationships at a system level that mirror that and support that, which only benefits the families. So that's been really exciting, and just broadening that community participation in that. Has been great. One thing for the future that I'm interested in is hearing more voices of parents, engaging parents about what is helpful to them, what do they want. Their voice is probably most important of everyone at the table. So some work around bringing them in additionally.
Thank you.
One thing. Oh.
No, go ahead, Melissa.
I just wanted to talk just briefly about, one of the things that Suzanne brought up is breaking down those silos and figuring out who needs to be at the table. And we brought in Treehouse as part of the collaboration, and they are offering support groups for youth in our community. And I can't tell you enough how big of a support that's been to the families that we serve. We serve families in crisis nursery through age 12. And so after they age out of our system, we're not able to provide that ongoing support. And so the Treehouse Collaborative has been just a blessing, and was actually something that I was looking for before this partnership was created in terms of referring families. And I did have a very successful referral for a family that we were working with as well. And I do echo Mary Kay's sentiment on the parent leadership piece as we transition Together We Can over to CAP. And we increase our steering committee and add people to our steering committee. That's definitely going to be a huge priority for us to get parents to the table. And at our last community advisory meeting towards the end of last year, we were able to have some of the parents from our parent support group come to the table and really talk about their experiences as well as the gaps in the community services.
able to speak to this as well. I just want to acknowledge how special this is. Whatever is happening in Scott County is really remarkable. Safe Families is in 15 other counties, and Scott County intentionally reached out to us and involved the faith communities. And we had a really exciting exchange back probably about 7 months ago, right before COVID hit. The county had some challenges with finding foster homes, and so they brought a team of us together and we shared our network and our resources with one another. We designed a presentation together, and then we called out to the faith community and those that we knew to just be aware of what the challenges looked like and how to come alongside foster kids. It was beautiful to watch, and I will say that I have never seen that in action across all the other counties that we're serving in. So I just want to give kudos to the work happening.
Thank you, Lisa. Heather, did you have anything in terms of things that you're most pleased with or work going forward?
Absolutely, and I think during previous discussions, I could talk for several days about how much.
How about we pare that down a little bit?
The way Scott County comes around families to support them, right? I think for me as a facilitator and coordinator, the biggest thing is really coming to consensus. We have so many different partners, and there's shared ownership. There's shared ownership in the end goal of ending child maltreatment, which is huge. There's shared ownership in each step along the way. We created indicators and outcomes and impacts that we're hoping to achieve together. I think we've really level set traditional power dynamics. So we have elected officials, judges, community members, parents, social workers, all coming into the same space and having an equal voice in moving this work forward. And I think that's been evident in our community events. I think in our strategies, one of our strategies really started from parents with lived experience saying peer recovery supports would have absolutely helped me navigate the system. And so right now we're looking at partnering with Minnesota Teen Challenge and Minnesota Recovery Connection and potentially other partners to bring peer recovery support services to Scott County. And so by our partnerships with parents and this shared ownership and collaboration, like we are actually achieving these strategies to support families and work across that child well-being continuum of deepened services and prevention services to mitigate some of the impact of that trauma, to prevent future trauma. So I'm so impressed by the work that everyone has done, and so just grateful and humbled to be a part of this work and invited into the Scott County community to do this. And I think moving forward, I just echo what everyone says. I also, part of my data nerdiness, I would love a program evaluator, right? I would love to ensure that we are making direct connections between the data and this work. And so trying to figure out some of those data sharing rules and how to evaluate our work moving forward outside of just implementing evidence-based strategies.
Thanks, Heather. Tamara, what are you most?
Oh, I would just say, I would want to acknowledge Heather and her hard work. So as much credit as she gives to all of us coming around, and I do think Scott County has had a lot of practice working across spectrums and across lines. And I think that we're starting to see the fruition of what that means and how you can pull people together quickly. But having that expertise at the table, as this has been a new area for me to learn about, I'll see like, oh, here's a program, and it's like, well, Heather has talked about that before. Like every time I see something, it's something that she has already helped us start thinking about. And what I've been most proud about with this is that this is really hard work, and that people are just seeing that commitment of people in the community. And then getting to these concrete places, steps of action. So just seeing the community come together to do the really, really hard work. And I'm looking forward to seeing it mature. It's kind of the next step. I feel like there's so much in place, ready to go. The data piece for sure is always huge. I'm very excited to see what we can do with the diversion piece and, first-time families. How do we get folks to the right place instead of always going to child protection? So that big shift to prevention, is always exciting, and it's smaller dollars upstream to make a bigger impact later.
Sure. Thank you. Brad, did you have
Sorry.
anything? All right. I think with that, we're going to turn it back to you, Mr. Chairman.
Thank you
Do you
very
have
much.
questions?
I thought maybe you might, yeah.
Thank you. Thank you, everybody. I have the privilege of serving on the Together We Can committee, and I'm probably not the best committee member, but I get there when I can. And it has been amazing to watch so much progress over the years. And I can't add anything to the wonderful things that you all talked about in our community partners, but I want to add a few comments, I think, for my colleagues, for people watching, for taxpayers who still might be like, well, that all sounds really cool and nice, but is that government's rule? Why are they doing this? That kind of thing. I think, for some of us, it's all about, well, kids and families and protecting them and growing them, and that's enough for us. But our job is to really think about those other issues too. And maybe this is going to play a little bit into our other agenda item coming up. But I think if we just look at the dollars and cents, and I see Danny L. outside the room, and the budget, we have to remember that Scott County taxpayers spend many levy dollars on out-of-home placement every year. And if we don't do something, that amount is going to increase substantially. Not because we have, hopefully we won't have more kids going to out-of-home placement, but we know from the federal and state levels that a lot of the money we're spending isn't money coming from Scott County. We're getting that, and the federal administration with Families First has said, we don't want to pay for out-of-home placement anymore. They're giving us this charge. They're saying, government, this is your role to figure out how, and Nikki, we love you and we want to keep you and all your colleagues, but how, wouldn't it be great someday if we had less child protection workers? That's the message we're getting. And if we don't do something, we're going to have a couple $1 million hit in a couple years because we're not getting that federal money. So it is our role to be a convener here. We're so lucky for our great staff and all these community partners who are like, yeah, we'll work to figure this out. So I think that it's important to have that framework in mind when we talk about this. This isn't just nice and feel good. Saves lives and children too, hopefully. But it is very much our role to make this happen, support it, and figure out how to go forward. For some of the other concerns I think that I've brought up is everything Together We Can is doing and talking about, we're acting very appropriately. Families and children, it's voluntary participation. We're hoping that voluntary participation helps so we don't have to do the involuntary action with families. So I feel strongly about this. I felt like I needed to get those comments out there. And it's hard, I think, whether you're a staff person or a citizen taxpayer, and your area, you might not even think about this, like, oh, the county's responsible for paying for out-of-home placement? Yeah, we are. If you're thinking about roads and bridges, sometimes it's hard to make that shift. So this work, so good to see the progress in the last year, but if we want to be good, if we want to protect children and families and also be good stewards of taxpayer dollar, we need to forward this work. It needs to be on high priority the next couple of years. So those are my comments.
That's it?
That's it.
Wow, that's...
No big deal.
Yeah, Leslie.
I just wanted to build a little bit on that, and this is one of your strategies, right? And it was building off your previous strategy, and it was probably only Chris, maybe, and Suzanne and I that sat in here in Child Protection's first Scott Delivers about 5 years ago now, and it was just child protection. And I want to commend you, Suzanne. I am a huge believer, as you know, in breaking down silos, and diversity leads to better outcomes and projects. In your leadership, to have a team like this working together, it's just tremendous. And you are to be, you and Pam and Mary Kay and Lisa Brodsky and those of you that are leading this, congratulations. I can't wait to see where you are a year from now. I told you earlier, this is my favorite Scott Delivers every year. And to watch the change, and I know it takes time, and why didn't it happen yesterday? But it is tremendous to see and to hear, and the support from these other groups, and the breaking down of that silo, and that we own this as a community, and that we are getting private donations and other nonprofits wanting to come and provide grants. It's your leadership. It's just been outstanding. Thank you.
Thank you, Leslie. Certainly, I think it is important to acknowledge, right, that there is a whole group of people, and there are people, this county has been uniquely positioned to bring in partners to help advance this work. And so it is not the work of one person or Scott County individually. It really has been a community effort of mobilizing people who have the same goal of how do we better support kids and families. So thank you.
My question is, was there a little tip that was sent out to everybody to say, hey, mention that 5-letter word, faith? I heard faith a couple times. I'm just partly kidding. I'm still kind of formulating my opinion. I probably made as many of you know, maybe chose the wrong meeting to go to once upon a time, which it just felt like a bunch of big government gobbledygook. But I'm giving the benefit of the doubt, so I don't want anyone to think, because I'm hearing some really good things, and I'm not as close to it as Barb is, and but heard a lot of really good things, and but I keep wondering, because words matter, if I'm in the spot where maybe I need some of these services, I'm looking at this logo on the screen in front of me. Wait, I'm not abusing my kid. I'm not neglecting my kid. I need some help, but if I do this, am I now all of a sudden that dad that, and then the bigger part of it, just talking out loud, one of our interested citizens talked about how he was in a hole, and his next line of defense was his family. Didn't need to go there, dug himself out, but it feels like something, and he noted that something had shifted, that the fabric of society, my words, has somehow changed or been hammered, or the screen has got bigger holes in it. So now it's become less of a family is your backdrop. Now we are all your backdrop. And I do believe the government should be a backdrop, a backstop. I don't think it necessarily should be the first line of defense. I know I'm getting looks, but
I just heard a little different message.
Yeah,
I heard him say, I didn't want to go to my family. There was some shame in that. I applied for WIC. It was a little difficult to do. I applied for unemployment, but I did it. And I believe government needs to be a backstop there to help those in crisis. And the family was also there.
And I'm for that. I'm for government being a backstop. I'm for government being, when you get, way outside and you need, some help. I'm for that. I'm just not for like, oh, your ball rolled just a little bit foul. Let us come in and, well, wait a minute. Like, let me deal with it a little bit. And so that's what I'm saying. My opinion is not fully formed, as you can tell. I'm just talking through this transparently. I heard a lot of really, really good things. But there used to be back in the old days, a Home Depot tagline said, you can do it. We can help. We got all the tools, but you got to ask. We got it. And I feel like maybe, and I'm not saying this is it, but government has said, hey, you know what? We can do it. Allow us to come in and intervene. And so I just want to make sure that us as a county, and I heard some of these things, that we're here to come alongside. We're here to kind of help out where needs be and to be proactive so that these things don't end up costing us a lot of money. So I heard that and I feel that. So I want to, make that known.
Acknowledge that, yep.
But I'm just partly wondering of the messaging, if that would help get more people involved. Just kind of talking out loud.
You should come to some more meetings.
Maybe I should. Well, I know I did the one and like, oh, yeah. So again, it's
Melissa with CAP here. I did want to respond a little bit. I appreciate your words, Commissioner Beer, and I think that As an employee of CAP for 11 years, I think CAP is the Home Depot of social services for the community. And so I think that when we're talking about government not being the be-all, end-all for the services, that's the goal here in transitioning the work over to the CAP agency, and has been the goal of Suzanne and Heather from the beginning in the messaging that they put out in the community advisory meetings, in the steering committee meetings, is that we know that government can't solve everybody's problems, and so we want to take a back seat in this and allow the community to rise up, and you know, the community grassroots efforts in this project are just astounding to me. And so, you know, I'm really excited to be taking the project over at the CAP agency, and coming from managing a program called Crisis Nursery for many, many years, I totally understand where you're coming from when you say, you know, families struggle to reach out when, you know, they feel like they're going to reach out, and the response is, oh, well, you're a bad parent. And so we're really flipping the narrative with this work that we're doing. And so that's why I'm just so excited about transitioning the work to CAP, and really empowering families to speak up and say what they need, as opposed to government coming in and filling in all of the gaps.
One of the things, this is Tamara, I'd say one of the things I have appreciated as well, though, is the opportunity to have these government staff be part of the work. Sitting at the table with Nikki and hearing from a frontline person, well, here's what's happening with the families. Like, a lot of times with collaboration, it's like, well, go do it, or, you know, there was always this thought of, well, the community could own this, or the faith community was supposed to own mental health. Well, you know, you have to have that structure. And so right now, a lot of this expertise sits with people who do work for the county. So having that be part of the work at this point has been really important and very, very helpful. But yeah, I think we are all excited about it transitioning to CAP, and people forget that CAP is not government. I'm sure no one in the boardroom forgets that, but I mean, I think that's something that we are looking forward to.
Yeah, and I just wanted to reiterate that, like, I don't want anyone to be like, oh my goodness, this guy doesn't get it. Probably a few people think that. I see someone smiling down here, even through a mask, but
I'm just kidding.
I know. Good chemistry, that's what it's all about. Like, I honestly do believe, in my heart of hearts, like, I'm looking at people in the eyes here, and I don't know, I gotta look at my camera, I guess, but, like, I do believe that we as a county, generally speaking, are equipped and filled with folks that want to come alongside and help people. Like, I believe that.
Yep.
I think it's an exception to the rule that sometimes one of our staff in whatever department it might be at whatever given time is carrying a hammer because maybe they had a bad day, and I'm gonna, you know, it happens, right? We're filled with people, and we're broken. So, but generally speaking, I have great pride in our folks. Yeah. That we're out about trying to do the right thing the right way. So, but I just wanted to be transparent and candid. This is the time we have this conversation to just kind of, you know, my opinions or whatever, and they're not fully formed, but I'm bullish, always have been, on the things that we are doing as a county, and we try to do it the right way. So I want that message to be heard first and foremost.
Remember, one of your values is, right, innovation and trying new and creative things and learning from the successes and from the failures. And so I think you are seeing a lot of that here today, and there probably will be some successes and failures along the way. But that is, I think, really innovative. And when you heard Suzanne say it's the first time in 23 years, that is huge, right? Because we still do have a statutory requirement to keep kids safe. I mean, we do. I mean, Pam and Suzanne, they have that. You have to do that. And so the big push was to figure out how to be proactive and prevent people from getting deeper into our system alongside with nonprofits and partners. And I think you're seeing that here today tenfold in how they're moving this forward. So
I'm told to look at the chats. I had to move to that screen. Yeah, I just think, you know, today, the meeting I went to, we had, you know, some hot shots from DC, the director of Equity and Inclusion and Justice, and a deputy director of Equity and Learning. Like, I feel like we're moving more away. We've had different workshops where we talk about inclusion. Like, don't talk to me about the government version of inclusion, big government, not necessarily Scott County. Like, today I heard more about true inclusion when you talk about faith groups. Like, I'm for inclusion just so long as it's the full definition of inclusion, not just the government, again, not Scott County, but just generalization of that. So that's what was a little off-putting a year or so ago. So
Sure. I wonder, I don't want to put words in your mouth, Commissioner, but I did like your point about the family piece, and maybe that, because like knowing the work that child welfare folks do, they're very engaged with families. Family is the first reach out. And so I wonder if that isn't just a constructive piece of feedback for them to think about in terms of messaging. And yes, we're working with nonprofits. Yes, we're working with community partners. Yes, we're working with extended families. It's just a nice point that is probably stating the obvious, and it's important to state the obvious. So,
And I think that's a priority for this board, and I think it's been brought up by, especially Commissioner Beer. I mean, all of us often, and just from my work with this committee, I know families and the family resources and helping families get stronger, more resilient to solve their own problems.
right.
Is key and priority. So, but really good reminder, because I think we should keep that at the forefront.
looking left, looking right, looking on my screens. 2 different pictures here. Anything else?
Well, I did send a commercial message through chat, but
Nice.
for fish. You talk about leveraging the community. We have this fish network, and I think it's really underutilized, to tell you the truth. We do meet quite a number of needs, and we have 800 plus partners and affiliates. And I just want to encourage you to think at top of the mind, I could post this to the fish network. This needs to be met right now by the community. So I encourage you to keep doing that. I know you are doing that, but even in greater measure. And thanks for your excellent work. We really appreciate it.
Thank you. All right.
Thank you very much.
Thank you, everyone in person and on Zoom.
Thanks, everyone.